Assalamu alaikum. Welcome to another episode of Health is Wealth. I am your host, Shabnam Riaz. Today we're going to talk about radiology, what it means and how it helps medical professionals in diagnosing and treating patients. We're here at Nexus Diagnostic Center and we're going to be talking to Dr. Ehsan Masood Gyani, who's an interventional radiologist, and Dr. Niza Mahmood, who is a consultant radiologist. They're both husband and wife, so a power couple. We're going to talk to them and find out all we need to know about radiology. Okay, so here we are sitting down with Dr. Niza and Dr. Ehsan, and we're going to talk about, as I mentioned in the introduction, about radiology. So thank you so much, first of all, may I say to you both for taking out the time and inviting us here today.
Thank you so much for giving us this opportunity.
It's a pleasure, it's a pleasure. I'm sure our viewers will really benefit from this program because there's so much information that you'll be able to give them. Dr. Niza, if I could start with you. You're a consultant radiologist. What are your areas of your expertise?
All right, basically my area of expertise is more in female imaging, which includes ultrasound breast and CT scans for breast CA. Then we also go for ultrasounds in pelvic area, uterus, ovaries and pregnancies, and TVS, which is the transvaginal ultrasound. And as well as it's the Doppler ultrasound. Doppler ultrasound is a type of ultrasound where you can see the blood vessels and assess them with the help of color. You put the color in the veins and the arteries and then you can assess them and examine them.
All right. And when would a person need a Doppler ultrasound?
All right, a Doppler ultrasound is required in a number of problems. For example, arterial issues are different. When there are arterial problems, you basically, a person when he feels difficulty in walking, swelling, wetness, color change or fatigue in legs, and swelling in arms or different kind of symptoms, they usually go to the vascular surgeon. And it's the vascular surgeon basically who examines the patient and sends and refers him over to us. And then we have to see, and more of here, I'm basically more of doing the ultrasound for varicose veins and for the dialysis patients to map their veins and arteries and the arms to make the AV fistula, which is required for the dialysis of the patients.
Okay. Now you mentioned varicose veins. What exactly are they? Is it something to be worried about? And if a person has them, what do they need to be, mindful about?
Yes, varicose veins is quite common, more in females, and it is something which is the most neglected thing. People usually don't take it seriously unless and until it really starts troubling them. Basically, whenever a person starts feeling swelling in the limbs and you can feel fatigue in the legs and long-standing hours lead to kind of swelling in the feet, and you can see veins protruding out and swollen veins in your legs, that's the time when actually you should go and visit a vascular surgeon. Basically, that's the time. But as it progresses, the color of the skin changes and then finally ulcers are formed on the skin, and that is the time usually when the patient goes to the vascular surgeon and then they end up here. And that's a stage when it is actually very difficult to treat it. And so varicose veins actually requires a proper mapping. The problem in varicose veins is that when there is increased abdominal pressure, there are gates in the veins. Those gates are actually responsible for opening correctly at the time when the blood has to move towards the heart. And in varicose veins, those gates or the valves, they're weak. As they weak more and more and they're weaker, the valve's function is so bad that it starts, the blood starts pooling in the limbs.
Okay.
Eventually it starts changing the color of the skin, and then ulcers are formed. So, and in females usually it starts after pregnancies.
Okay.
And actually after pregnancies, you know, these females get into that baby and all that stuff, and they
So they're not
tend
looking
to
after
ignore
themselves.
themselves. And then they have a second pregnancy and then third pregnancy,
gets
and they're
worse.
actually doomed when they end up with us.
Oh.
So it is actually very important to get the correct mapping done to actually figure out where are the gates which are doing the wrong stuff, so that they're blocked. And that is done either by the interventional radiologist. I assume an interventional radiologist is a better option to treat it, but vascular surgeons are also doing it. So either ways, it's fine as long as the patient should go and visit the doctor.
Right, okay. So you mentioned interventional radiologist, and that's where we'll come over to you, Dr. Ehsan. Tell us about your areas of expertise.
I'm an interventional radiologist, and what that means in, let's say, simpler terms is that we do minimally invasive surgeries.
Okay.
We treat patients without any cuts and without any, it's a non-scalpel technique in which we don't have usually any stitches even, and we work with catheters and we work within the arteries and veins to correct the problems the patients have. Now that can be that we can be opening up closed arteries, like the cardiologist opens up arteries in the heart.
Right.
We can open up arteries in the limbs, and we do that routinely to help patients save their limbs.
And in what situation would they come to you with these?
Patients with
symptoms?
diabetes, they would have non-healing wounds
Okay.
in the foot with long-standing diabetes, especially in our country where people don't really take care of their feet like they should. And they come with non-healing ulcers and wounds which used to require amputations. With the advent of interventional radiology over the last few decades, we've been able to open up the arteries, so more blood goes down to the wounds and it helps in healing. And what we are able to do is, we are either able to avert an amputation, which is a huge thing, or we can lower the level of the amputation. Because of our treatment, the level of amputation goes down. Below knee amputation can be reduced up to even a few toes. So and it helps in healing as well, because in diabetes one of the main issues is closing up of arteries. So those arteries, if they can be opened, they are really huge help for the patient. So, and if a patient comes to us who is bleeding inside the abdomen, in the bowel, the surgeons would have to go in and do a huge operation, and these patients are usually dying with this bleeding. So we have to go in and do an emergency procedure to close off the bleeding artery. And that's a life-saving procedure as well. So in short, what we do is we open up closed arteries and veins when needed, and we can close the arteries which are bleeding. And the similar procedures we do in all different areas of the body.
I wanted to ask you, what age group, or do you get a specific sort of range of people? You mentioned diabetes. Is it the older ones or the younger ones? It doesn't make a difference. Once you have diabetes, you have to be very careful about this.
So the age group for the patients we get is different for different diseases.
Okay.
For diabetes, it's usually older people who have had long-standing diabetes, because it takes a long time for the arteries to get diseased.
Okay.
But for dialysis, we get patients, like tomorrow I have a patient booked who's 10 years old. What we do for them is we place catheters in the veins, which help in the dialysis process.
Okay.
For cancers, for liver cancers, we usually see middle-aged 50s and the 60s. And unfortunately, we're seeing more and more people coming in the lower age group now as well. And for that, for liver cancers, we do different procedures. We can either close the feeding artery of the cancer, and that will help reduce its size. We can also place needles into the tumor and inject poisonous substances which can, like alcohol, which will denature the tumor, and there's certain needles which can burn the tumor from within. So we help place the needles there, and we can, by help of a machine, we can burn the tumor. So what we are doing in interventional radiology is multitude of different procedures for different diseases in different age groups.
Right. And you mentioned liver cancer. Unfortunately, as you said, you're seeing more and more patients of a lower age group as well. How much of a problem is this in Pakistan? Proper screening, the lack of it, and people being aware of the medical issues that they should know about. Please tell us about that.
So liver cancer is one of my passions in my work, because I've been working with the transplant teams for years, and we've been treating a lot of patients. So as you rightly said, screening is of utmost importance. If I see 10 patients a day of liver cancer, 5 of them would be beyond any treatment, any possible treatment, and this would be, they can go anywhere in the world, because all of the treatments that are available internationally for liver cancer are now available in Pakistan.
Okay.
We can do most of the, usually all of the procedures. So if you detect the cancer earlier on, when it's asymptomatic, for a breast lump one would feel it, but for a lump in the liver, the patient only feels it when it grows to a certain size and it starts to give symptoms. In smaller sizes, when it is curable, it's not treatable, it's in the curative stage, it is usually not detected. And how to detect it is that you do routine screening ultrasounds from a good place every 6 months.
Every 6 months?
Every 6 months, for not everyone, for all patients who have high-risk patients who have hepatitis B or C or any other cirrhosis.
Okay.
So this is extremely important, and when I see a patient who has come up with a small tumor, I tell them that it's a blessing from Allah, because this is not the reason you went to the doctor. This is a chance finding, and there are a lot of patients who do come with that and they get treated. So the scale of the problem in Pakistan is huge. Why? Because the basic cause is hepatitis B and C, and it's the number of Pakistan ranks very, very high up in the number of patients of hepatitis B and C. The prevalence of this disease is huge in Pakistan, and there have been multiple papers, scientific papers, which have been published, but unfortunately this is not that well known. And patients, I get multiple patients who have had cirrhosis for years and decades, and they won't have an ultrasound. So it's important to do an ultrasound screening every 6 months.
Every 6 months, okay. You mentioned hepatitis B and C. Can you tell our viewers, a bit about the symptoms, how a person can know if they have this, and vaccines available, or what is the treatment?
Hepatitis C is not my place of interest, or I don't treat hepatitis B or C. Okay. That's for the gastroenterologist and hepatologist to do. Okay. So we would treat cancers and symptoms. Also, what we do is that for other cancers, we do palliative treatments to improve the quality of life. Okay. And for that, we would place drains in the abdomen to take out the fluid, so the patient feels better, and reduce the jaundice as well. So there are different procedures that we do for palliation, and all this is not painful at all. We do all the procedures, 99% of the procedures, in local anesthesia, and in an outpatient setting as well. So that's how.
I think it's more a fear for a patient when they see a doctor and they're being told that they have a procedure, that immediately they think it's going to be painful, or you have no idea what's going on. So how do you counsel your patients? Dr. Nizar, if I can ask you this, and then I'll ask Dr. Ehsan as well.
There is no intervention involved. It's just an ultrasound.
Right.
So basically you just have to tell them that, it's just I'm going to apply a gel and it's a screen and you're going to see the image. So they're kind of fine. And as far as counseling is concerned, it is basically needed for the female patients who have got breast lumps.
Right.
That requires a lot of counseling because you know how we are actually, these females usually do not come to the doctors again, just like the varicose veins patient, and in those as well, the females in this area also, the females do not pay attention to these lumps. And now we have to actually really counsel them in a way that you have to tell them that they have to get the biopsy done. I don't understand, but there is some myth that they think that whenever there is a biopsy, the cancer tends to spread.
That's very true.
Yeah.
Very common.
So everybody tends to run away, straightforward.
So Dr. Nizar right now is addressing this very important fact that people come across with this myth that if you're getting a biopsy done, cancer, or it may not even be cancer, because that's why you're getting the biopsy done, it will spread. That is absolutely not true.
That is not true, and that is mandatory and very important to get the biopsy done. And here we can also, in this setup we have interventional radiologist again who does this biopsy. And then you have to tell the whole family that, if there is one female patient who has got the lump, then all of them have to get their ultrasounds done, whether they feel a lump or they
not.
don't.
They have to
and
be
then
screened.
There was a time when there was a higher incidence of breast cancer in females above 50 years of age, but now I would tell you that the youngest patient with breast cancer has been just an 8-year-old girl.
8?
Yes, just an 8-year-old girl, which was very shocking for us as well. And then you have a lot of patients who are unmarried, young, in just teens and early 20s, and they have breast
Did they have a
cancers.
history? Or it can just come
Not
out of
necessarily. And I would mention, for some reason, I have observed that there is a very high incidence of breast lumps and cancers in patients who are coming from Azad Kashmir. I don't know why. And I haven't seen that documented anywhere, but here we get the patients more from the northern areas. And from Kashmir, I don't know, whenever I have a patient from Kashmir, they end up with either a breast lump which is benign or cancerous, but they have a very high incidence. So that's something which needs to be, addressed, that why is this happening in that particular area. And here they were previously very, there was considered that, those who do not breastfeed their babies and females with family history and those who have very late periods or, early menopause and all those kind of things, those women are basically have a higher chances of developing breast cancers. But now I don't think there is anything like that. Maybe because we have radiations all over, we have chemicals in our water and everything. So these females of every age, whether family history positive or not, breastfed or breastfeeding done or not, we have all sorts of people. So it is very important that these females take these lumps seriously, and if they want to go for a homeopathic treatment or they want to end up with the herbal treatment or something like that, I never stop them from going there, but I do advise them they should continue this allopathic treatment side by side, not to leave that. Then they do not come for follow-up. Then these things, yes, and until and unless the mass really comes out and it starts stinking and the whole family starts observing, then they end up here. So these are very sad things. That is the area where I really have to counsel the patient.
Okay, so you were speaking about they come to you if they have a lump in the breast, but it doesn't have to be just that will indicate if there's a cancer or a tumor. Other things as well, change in shape, size, anything like that, that's something that has to be taken.
Change in shape, color, size, and basically a nipple discharge. There is sometimes a very small nipple discharge, like 1 or 2 drops. And it can be of different colors, be it milky, be it greenish, brown, or blood. and when it is a bloody discharge, that's almost 90% chance of having a breast cancer.
Okay.
Then again, when they have a discharge, they feel there might be some kind of injury or something, and then don't come.
Right.
So that's the basic problem here.
You know, I'm just shocked at you mentioning the 8-year-old case, because that is something that you absolutely do not imagine.
Absolutely
You know,
not.
so I mean that would make people really sit up and take notice.
Babies are born with breast lumps actually. There are babies who are born with breast lumps.
Okay.
So, but fortunately parents are really, you know, concerned about their babies, so they do end up in the hospitals and with the doctors. But these, as the females, you know, grow up, they usually ignore it.
Yeah, because it's taboo society, lots of cultural, you know, inhibitions.
And yes, one more thing. They really need to understand that this area is basically, it is for a breast surgeon to examine. And they usually end up with gynecologists.
Oh, that's very common.
Yes, and
yes.
you know, that is another mistake. People need to know that whenever you have a breast lump, it's a breast surgeon you have to go and see, not a gynecologist. That is another thing which really, you know, disturbs the prognosis, the treatment, and everything is disturbed.
Because they're running around in the
yes,
wrong directions.
Yes, wrong
And
direction.
you said breast surgeon, not just a general surgeon, but a breast surgeon?
Well, it's preferable to go to the breast surgeon, not to the
Okay.
general surgeon,
How
but at
many
least a
around-
surgeon.
Yeah, okay, but in Pakistan, how many breast surgeons do we have? Do we have
Well,
quite a
initially
few?
we didn't have many, but now there are many actually. And
Okay.
here in Islamabad, Pindi, I would say that CMH hospital has got a very big breast, there is a whole big setup just for the breast clinic,
Okay.
dedicated. And
Right.
it is really doing wonders.
Right.
And you have breast surgeons, if you just, you know, you have to look
You
for
just
them.
have to find out.
Now it's very
Okay.
easy to find out. Actually, you just Google it and it pops out.
Right, okay. Dr. Ehsan, tell us about your setup here, because you've got the radiology, the interventional radiologist here. So you're working in sync. When something is detected, you have the treatment as well. What else is available here? What type of patients do you usually see?
We have a CT scan machine here and a few ultrasound machines. We have a dedicated laboratory here and an OPD setup as well, with an X-ray as well. So what the patients that we see, as you said, we collaborate and help each other. And if a patient comes to Dr. Niza with some fever and she finds that the patient has some collection in the abdomen or in the liver, she has some pus in the liver,
Okay.
she would ask for a CT scan. We usually talk to the referring physician as well, and they would say, yes, go ahead, do a CT scan. We have that available here. We do it at the time, because these patients with the abscesses would be running very high fever.
Okay.
So once the abscess is confirmed, we would talk to the physician, and she would tell us, me or our senior sir here, who would be placing a drain. We would place a drain into the collection to take that pus out. So what we're doing is, it's a very small drain, it's a very small simple procedure in which we place a drain inside, and most of the pus, if it comes out, which it usually does, we save the patient from a major surgery.
Okay.
So in a few days we would just take the drain out and the patient would be cured of that. So this is how, in different, for example, for breast lesions, if she sees one, we can do a biopsy right away, because patients who go back, they tend to usually go and talk to 10 different people,
And you're wasting time, and then so many people will be giving exactly those myths will come forward.
So the myth that you're talking about, the main reason of all the patients come to me and tell me this, because I do the biopsies during the counseling, they would ask me, will this spread? Because I've heard someone has told me that if you have it done, it will spread and the patient will die.
इसको छेड़ते नहीं हैं, इसको touch नहीं करते.
The
That's what
reason,
usually they say.
what the background is, that the patients, usually 80% of the patient presents so late that if you do a biopsy or you don't do a biopsy, the patient will probably not survive a few months or so. So if you do a biopsy, it usually comes to कि ये biopsy करवाई थी तो उसके बाद वो चल वैसे.
Whereas this is preventable if it's followed up, screened properly, taken through the right path.
Detected earlier.
Yeah.
Exactly. And this is applicable for all cancers now, because the new chemotherapeutic agents are very good. The science is advancing so rapidly that quite a few are curative now. So there is hope, but we need to work for awareness of all different aspects of this problem.
Again, I think it's that unknown fear of what is going to happen. It's the word, actually, of cancer, and then the word of biopsy, that these things just trigger so many alarm bells going off. People might have had a relative or a loved one or a friend going through something, and they may have had a tragic outcome. So it's just the word that sparks so much fear and so much, chaos. And then unfortunately society also contributes to this, because we have family members who may be insensitive to what they're saying. They'll scare the patient off further, and it just basically everybody running around like headless chickens. Whereas what you need to do is be focused and seek out the right medical help. You mentioned biopsies. What are the main concerns for people who come in for a biopsy? You mentioned about the myth that they say that, if we touch this, will it spread? Are they worried about pain? Are they worried about what?
So the procedure of biopsy, it takes usually 5 to 10 minutes. There is no cut.
That is no time at all.
Yeah, the main time that we spend is in counseling. And that's how most doctors should be doing. And in dispelling these myths and other issues, the doctors need to step up and give the patients more time and talk about it. So a patient who would be coming to me for a biopsy would have 5 family members sitting next to him or her, and they'll be very concerned about it, about what issues that can arise. But patient can bleed. There's a very little chance that he may bleed, and during the counseling we have our job is to tell them about the procedure in layman language. Everything about the procedure, what they will go through pain wise and everything else, and what they should expect. And once I've very rarely have had patients who would go back and not get a biopsy done after you counsel them correctly. And we also tell them about the possible mishaps that can happen, like any bleeder or non-diagnosis, which is also very rare, but it's there. They should be knowing about it, so that they're better prepared. And we have backups for everything. So counseling is the major part, and that takes most of the time. And then we follow the patient up as well for any pain and all. Pain is, thank God, it's the least. After the patient gets the biopsy done, 90% of the patients are so happy.
They're relieved.
Yeah, because the tension at the back end helps me as an intervention radiologist, because after they have had the procedure and they're very relieved and they think I'm a very good doctor, but the procedure itself is.
Well, I'm sure you are. You're being modest.
So it helps me in the way.
Yeah, right, okay. And what about your work in regard to dialysis?
Dialysis is a huge topic, and the facilities available here, the doctors and the patients, even the doctors, need to be aware of the services that the patients can avail. So there are different tubes, there are 2 different types of catheters or tubes which are used for dialysis. One of them is a temporary catheter, which is very easy to place and is being placed all over. And it's valid, usually it is recommended that you keep it in for 2 weeks and then follow it up with a long-term catheter, which interventional radiologists place, and that can last on an average from 4 to 6 months. So one should get that done, and the physician should be guiding the patients that you do have that done, and then place a long-term catheter, and then go on. You use that 4 to 6 months while the catheter is still working before it gets infected and it is a cause of problems. So before it gets infected, you go on to have a fistula made, which a vascular surgeon makes, which lasts for an average of 4 to a few years even. Or even better, get a renal transplant done. So our work is to give a certain time to the patient, and the physicians who refer them should be guiding them to have the definitive treatment later on. But in our place, the patients usually have that temporary catheter in for 2 months, and they end up with infections and come to us for other things. So it's we are working on raising the awareness of this amongst physicians and patients as well. So dialysis is a huge load. And secondly, also for fistulas, what we do is for a failing fistula, we can open up the fistula. How a fistula fails is that the artery or the vein gets stenosed or closes down. And if we get those patients earlier, we can open that artery or vein as well. So the fistula, which had been working for years, can maybe work for another couple of years, because there is very few places in which you can say once a year I get a patient who does not have any access to the blood vessels, because patients would have for years would have been having catheters and fistulas made and all, and we have to place catheters through the liver. And once in a couple of years, I can remember 2 or 3 patients for whom we could not do anything. We could not access any artery or vein to offer them dialysis. And there is very few options other than this. Peritoneal dialysis is now coming up. It's a bit expensive, but it has come up in Islamabad, I'm sure in Karachi and Lahore as well. But other than that, there are not many options left for these patients. So it's unfortunate, but that's why we tell people that it's extremely important to know where you're placing catheters and how you use those options wisely, so you can have a long-term life, prolong the life of the patient.
And the quality of life as well, which is so important. Dr. Nizar, tell us about a success story or somebody who came to you and you caught something earlier, and then the right path was taken, and maybe they came back to you for a follow-up, and something good, that positive.
All right. There was a patient I had whose mother basically was a patient of breast cancer, and she had survived. And she told me that when she got that cancer, she had a child about 4 years old. And at that time, she was really, really scared that if I die, what is going to happen to this child and everything. But she got the biopsy done at the right time. She got her treatment done. When she came to me, she told me, and her breast was totally fine, it was clear, nothing was wrong, it was follow-up. And then she told me that it was basically 20 years ago. That girl is now 24 years. And she has had a baby 2 days ago. So she said there was a time when my girl was just 4 years old, and I was thinking what will happen if I pass away with this cancer. But then she really did everything which the doctors told her, and now it had been 20 years and she was holding baby of that 4-year-old girl she was worried about. And then there was another girl who just came with a little discomfort in her breast, and that was a very intelligent thing to do, because she did not feel any lump or anything, but she just came because she had a discomfort. And she said, let's get it examined. At that time I couldn't even see a lump in the ultrasound, but there was something, a slight area which looked like different from rest of the breast parenchyma. So I just marked that area that this looks a little bit different. And then again, we had the interventional radiologist with us. So I consulted, and it was Brigadier Salim Raza. And I showed him, and he also said that this area looks like off and a little bit different. So we just asked the patient if she's okay. We go ahead with the biopsy.
Okay.
And
that can be done, sort of somebody comes to see you and you see something, and you can do the biopsy right then and there?
Of course. You just have to take patient's consent. You have to ask the patient if she's all right with this, and she was brave enough and she was aware and she said yes, why not? If there is something wrong which you can't even make out if it's lump or what, then why not go ahead with the biopsy? Let's do it. So, and we did the biopsy, and it did turn out to be a cancerous area, and then she had a surgery at that time, and just because she came very early and she did that biopsy, we could go ahead with a breast conservation surgery. The whole breast was, it was not needed to remove the entire breast. It was a breast conservative surgery. And she went through a few cycles of chemo and radio, and then she was fine. And now it has been like almost 10 years. She's clean, she's fine, she's happy. She was unmarried before when she came with this, but now she's married, she has a child. So
that's fabulous.
Yes, that's fabulous.
Because unfortunately it seems that all the bad news comes to the top, and you'll hear the bad stories, and the tragedies, but whereas there are, and I'm sure that people watching this as well, they know people who have come through, who have been able to recover fully from, cancers.
And we have a tendency to, narrate the tragic stories and, that this happened, that happened, and the success stories are always
the ones
forgotten.
that, that get sort of, missed.
Gossip and bad news sells more.
Yeah. That's very true, unfortunately.
There's one more thing that I would like to share. Actually, it is basically, again, Dr. Ehsan's area of expertise, but since I witnessed it, I would like to mention it, that the patient's willpower matters a lot. I've seen patients coming to Dr. Ehsan with really small masses in liver, and the liver cancer basically, and Dr. Ehsan usually when comes and sees the CT, he's like, this is a very small one and this is curable, he's going to be fine. Then there are people who patients come with like huge masses, and Dr. Ehsan is like, partially treatable maybe, we'll try and we'll see how it responds and everything. And do you believe patients who have a very good willpower, they're strong and they're determined to, get the whole treatment done, they usually end up being cured totally, like huge masses. I've seen people with huge masses being cured and responding so well to these treatments which Dr. Ehsan is doing, and those with little small masses actually dying. Just because they just lose it, they don't, they feel like, terrified, and they're depressed and they're upset. So basically, if you have that willpower and you really know that you really feel that you can fight it, your body ends up healing it.
Yeah, that is
very
true.
important.
That is so true, the power of positivity.
That is true, and that's why another myth is 90% of the patients' families tell me, in isharon se ke, please don't tell him he has cancer.
That
and
is
obviously
so important.
That's very important, because I don't tell the patient at that time, but I ask the patient, or I meet the family later on, especially for this, because I've noticed in my short 8-10 years of work that patients who, and I tell them to their sons and daughters, that patients who know that they have cancer, I have seen them surviving more than patients who are not told. They don't, it's not that they don't know. You are the children and he's your father. You think he does not read your face that there's something wrong?
Exactly.
I have seen the patients know without them telling their children that they know. So it's extremely, you can't hide it.
You can't. You can't.
Yeah, it's for yourself that you feel that they don't know, but they actually know. And I've seen patients definitely, like Dr. Niza said, surviving more and further, and their treatment being more effective when they know. And I think that's very important. That, and in Islami tariqe-kar se bhi, it's their right to know their disease.
Absolutely. When we talk about doctors and the medical profession in our part of the world, how much time do you think is given towards the counselling of patients? Because that's something that usually, because I know you two are very empathetic, So when you're a doctor and you have empathy, that's a fantastic combination, and that really helps with a patient, because for them, just going to a doctor who is friendly, who is understanding of their situation, who is willing to enter a conversation with them, makes such a difference.
So this would be another case of gossip and bad news sells more. So I'll not get into it because we can get started. We hear stories.
A very diplomatic answer.
Yeah, we hear stories every day. But वो मुझे कोई कह रहा था कि डॉक्टर हैं यार आपके पास तो जन्नत कमाने का बहुत ही, and people are right that there's a huge, but गुनाह कमाने का भी बहुत ज़्यादा हमारे पास मौका होता है, because if we don't counsel the patient right the way they should be, then we're doing wrong. And counseling is one thing, malpractice, non-ethical practices, and I tell people and friends, and obviously I'm telling you now as well,
and a lot more people,
and a lot more people, and I think people would agree. It's not to make it sound bleak or helpless, but we are as corrupt or as negligent or as careless as any other profession. And all of us have gone through, even us doctors have gone through stories in our lives which we have met the wrong person in the medical field. So my message to my colleagues, and especially my colleagues who are teachers in medical colleges, is that ethics has to be taught by word and by practice.
Yeah.
We have learned a lot from our teachers, and there's a lot of things which new doctors are learning which is wrong. So not going into details, it is, but people would understand, everyone would understand if everyone has stories.
Yeah.
So unfortunately, let's pray that our society as a whole rises. We are part of the society, and that's why the corruption or the negligence or whatever not.
Because it's such a noble profession. I mean, it's a profession where, people look up to doctors. If you're outside traveling or something, somebody's ill, a lawyer, an engineer, a banker, nobody can help you. But after Allah Ta'ala, of course, it's a doctor. So it's a very noble profession.
हाँ जी बिल्कुल ऐसा ही है, but and I tell my colleagues as well that हम देखते हैं रोज तो human beings as anatomically, as physically, we are such, but we see the strength of the human body once or twice a week when we see the problems they went through, the negligence, the wrong procedures, that they can withstand it's amazing how strong we are, and that strength जो अल्लाह ताला ने हमें डाली हुई है हमारे जिस्मों में, because of that these things don't crop up so much so in the routine life जितना हम देखते हैं as doctors. So the message would be कि it's high time, stop seeing and blaming everyone else, the politicians and all, and we have to correct ourselves
We
first.
are accountable for
And
ourselves.
trust
and
me,
what we do.
we're not doing a good job.
Yeah. Well, there is hope out there. There are people who are, I think, people in the medical profession who are really serving humanity.
Lots of people.
So well. And the problem is, those people are the ones you don't hear about. You don't know about, as you said, again, gossip and bad news. So, but I think when you find them, they should be our role models. They should be the ones that are on the television, on social media, everywhere, and we should see them over and over and over again. So they are humanitarians.
There are a lot of people.
And a lot of people who are absolutely amazing. And they should be the ones giving out those messages, because, as you said, it's what you do, it's how you practice. That's how people are affected.
When we have a catastrophe here like floods, earthquakes, it's that time when actually you come across those doctors who just leave everything behind.
Yes,
they just
selflessly.
leave all their work, their clinics, everything. They sacrifice all their practice. They just go to those areas to help these people out. And those actually are human doctors, I would say. Because you know, have you heard that statement of a patient who always says, half my disease is gone after meeting you, half my disease is gone after meeting you.
That's true.
That phrase is so important, because I told you that the willpower of the patient matters. So when you actually talk to the patient, explain everything, encourage him, even when you go to these flood affected areas and all, in which these patients are, you know, helpless totally, and you just tell them that we are here and this is what is wrong with you and you can fight it. You just have to tell them that they can fight it. If you inculcate that feeling of you know, that they can fight it, the disease will be gone actually, the patient is ready to fight it, and they're actually already happy. The happy hormones that they release in the body, they help heal it. There's no match to that.
I remember myself many times calling a doctor or somebody in the medical profession and saying to them, you're an angel. Just for the way they treated, the way they, you know, spoke, the way they interacted, whether it's with myself or a family member, and so many other people would say that you have that angelic quality then when you say, you know, you're the ones we're coming to for help, and the way you're treating us is making such a difference. So unfortunately that's all we have time for in this episode. And Dr. Nizar and Dr. Ehsan, it's been wonderful talking to you.
Thank you so
And
much.
we would like a very short message from you, Dr. Nizar, and then Dr. Ehsan, before we wind off the program.
A very short message basically is that it is a time where diseases are very frequently growing fast in all age groups and everything. Just don't ignore yourself. Anything which you feel is wrong with you, you need to address it. Just go straight to the doctor, and it is going to end up in your favor, because either there is nothing wrong with you, you'll be calm, and if there is something wrong with you, it will be addressed earlier and you will end up cured.
Absolutely. Dr. Ehsan.
मेरी तरफ से तो ये है जी कि I hope that the patients would go to the right person. Whatever disease they have, they end up with the right person, with the right specialization. And the people who would go to persons, doctors who are not very talented or very trained in the field, they should refer them to other places who would treat the patient better. So I think now is the time to raise awareness and help, because in today's world there's a lot of misery already.
Already.
Yeah.
Right. Okay, so Dr. Nizar and Dr. Ehsan, thank you so much for both of you to sit down, take out all this time and share this wonderful information with us.
Thank you so much.
You're welcome. Thank you for coming.
It was a pleasure to be here. Okay, and so, you know, I really hope that you take those messages very positively and very seriously. As they both said, it's very important to put yourself as a priority and to understand that if there's something going wrong somewhere in your body, you need to get professional help. Do not ignore it. So until next week, stay happy, stay healthy. Bye-bye.